next, we have our next speaker, who is Mr. Dormate. He is the head of QOMI and has been a very, very generous mentor for all of us at UIMS, and he has a very intriguing talk for us.
So my name is Dormate. I'm actually an ophthalmologist. I'm a 2004 graduate from LF1. So the reason I'm here is you are going to be the next generation of doctors. Not all of you. I'm pretty sure that not all of you will actually start working medically. Some of you will just say, wrong. It just don't enjoy it. It was not a wasted 6 years of my life, but it's the wrong field. I'm not going to do that. If you really do have that feeling, get out. Don't do it. Finish off university. Get that degree. Don't work as a medic. Don't do that. Because otherwise, you are responsible for people's lives. And if you don't enjoy your job, you can't do it well. That's just from experience talking. So, let me try and give you the prep talk so you will hopefully all go into medicine and become the doctors that you should become, because you deserve it and your patients deserve it. Now, why do you want to go into medicine? Why did you start studying medicine? Anyone?
Because it's interesting.
Did you always want to be a doctor? Did you have any other options? Did you think about economics, law?
I studied economics before.
Okay.
I finished my bachelor's, but I had always a big interest in medicine.
Okay.
And this is why I ultimately pursued it.
Great. So you obviously made a choice, and since it's a second career choice, it means you really wanted it. What about the other ones? Who went into medicine because mum and dad were doctors? Come on. Absolutely. Right? Did you have any other plans? Were you going to do something else?
Never know, but for me as a child, it was always, you know when you're on a plane, and then one of the flight attendants says, "Who's the doctor?" And as a child, I always wanted to be the one to raise my hand.
Okay.
Especially mom and dad, that was a trigger for it.
That's great. I think it's fantastic. Well done. Okay. Okay, who else is here because of other reasons? Who wants to make tons of cash as a doctor? Okay, fair enough. I'm there with you, totally. Who else? Who wants to save the world? Okay, really? Good luck. Yes, one person at a time. You know, try and become Elon Musk first, and then we can talk about the rest. Right, so let's get into it. You are probably studying one of the hardest courses probably on the planet, I would assume. It's long, it's tedious, and I don't think anyone told you it's going to be so much fun and you're going to have such an easy life, because that would be a lie. But now looking at it, I mean, you're all into it, you're what, first, second, third, fourth, fifth year, 6 years, whatever you are. How difficult was it really? I mean, you know, a couple of all-nighters here and there, long weekends maybe, no parties sometimes, but otherwise, it's not that difficult, is it? You know, I mean, I've seen people finishing medicine where I just thought that it's incredible. You know, how did they get that from? And they still manage. It's not difficult. You just have to keep at it, read, be there. Now that's as a student. So what happens? Nobody said it was easy, but it can be. Let's start with the roller coaster ride. You go into faculty, you start studying, you adhere to your courses, you wake up every morning, you've got your 5-day week, weekends are off usually, sometimes even the weekdays are off, a lot of them. You keep on going, and then you start realizing, bugger, that is just so wrong in so many respects. It's not always fun, is it? So, your problems are, you always have to study, you're always involved, it's so much hard work, all the books you have to read. I mean, just imagine you would be doing law. Law is less, like way more to read, and it's really dry and boring. Medicine is really cool in respect. Limited social life. Who's got a limited social life? Come on, please, hands up. You have, really? That is, did you have a limited social life? You didn't, did you? What does limited social life mean? I mean, we used to party 4 days a week, go to faculty, study, take exams, and still party 4 days a week. That's not limited social life. I don't know. I think you've got your work-life balance somewhere not quite right there. So, High levels of stress and pressure. Who's got stress and pressure? Yeah, I would assume so. Still? Come on. Okay. When is the stress and pressure higher? 2 days before the exams or all through the year? 1 month before, right? Got you. So, and you feel like you never know enough. And you know what? I think we still feel like that after years and years of experience and working and treating patients to the thousands every month. We still feel like that, and it will never stop. And that's the best feeling you can have, because that's the feeling that will make you thrive to be better at what you do. If you think you know it all, if you are turning into an arrogant Ponce in a white coat, you will kill people. Always think about that you are not good enough, and there is always better to be done. So go for it. Your patients deserve it. It's not for you, it's for your patients. Little rules that make your life easier. Who's read that book? Just from the name. Gomers? Anyone knows that? You don't? You've read it? No? Okay. Right. I'm going to bring you little wise rules. At the end of it, I'm going to tell you where I get these rules from and why they're important to me, because I really stuck to those rules. And this one book is the reason why I went into medicine, just because I read it, and I thought it was amazing. So Gomers, everyone who's worked in ENT or A&E, you have tons of patients coming in. They all think they're sick and dead. Most of them are. But then there are the ones that are just like, I'm bored at home, there's nothing on TV, I'm going to go into the A&E and I'm going to bother the doctor and I'm going to pretend I've got something, and they will never have a problem. These are the Gomers. Get rid of them. It's really important because it saves other people's lives and your time. The pros of being a medical student. Let's see what there is. You're learning about the human body. That is great. So you're learning about the human body, you're learning all this really cool, interesting stuff. You're going into high-tech procedures like the colleagues showed before with the Da Vinci and robotics. It's amazing. Seriously, you never get bored. There's so much to learn. There's one downfall though to university. I'm going to tell you later. You're making new friends who understand your struggles. Okay, so how many friends do you really have? Loads, I assume, right? Are they all medically related? Are they all... Most of them, right? Right, you will probably never have any other friends in your life later on. They will all be doctors. You will always just talk about medicine, about patients, about your pay grade, about this, about that. You're going to be raving about the system that you're going to work in. If it's in the UK, Germany, or Australia, it doesn't matter. It's always going to be wrong. There's no right system. It's always wrong. And we never get enough cash. True. So please look for other friends as well. Stay on Facebook. Don't cancel your Instagram account, but do register with Kiyomi later on. I'm going to tell you why. Challenging and rewarding experience. Yes, it is. Which ones of you have actually worked in a clinical field, like with proper patients? Which ones of you have done weekends by themselves with other doctors in a hospital, just for experience, just for the fun of it? Which department did you go to? What did you do? Orthopedics. You? Oh, great. Emergency medicine. Okay. How much were you allowed to do? You were just shadowing, basically. You were standing. No, you were allowed to put on hands. That is great. What, in Czech Republic or where?
Keyboard.
Where?
Keyboard.
Okay. Anyone else? Where did you go?
Pediatrics in UK.
Pediatrics in the UK. Cool. You?
Surgery
Where, here?
in Germany.
Are you German? Ah, okay. Your English is very good. You? Very good. Okay, cool. If you do have time and the opportunity, keep doing that. When I was a student, I had to interrupt faculty, university, after my third semester because I was German. We still had that obligatory, you have to go to the army service or you do a social service. So I got a little letter at home saying if you don't show up to Germany by that and that date, you're going to be put in prison for 6 months and you're going to pay a 20,000 Deutschmark fee back then. So I was like, right, I'm going to interrupt university and make my way back home. So I didn't want to go to the army because I don't like people telling me what to do. Did social service, which was great. So you're basically kind of like a male nurse, and you do all the cleaning and feeding and bedding and whatever nurses do. So that went on for 13 months. It was actually probably one of the best experience I could have had at the time, because the procedures I was allowed to partake in, to do every day. When I came back and I was doing shifts in the hospital, sometimes over here, people were like, how can you do that? Where did you get experience from? Plus the contact with the patients every day. I mean, you're really physical. Don't stop being physical with the patients. Always have contact with them. I know you're not supposed to touch your patients. I mean, Jesus, I mean, not in the wrong way, but please have a contact. You know, show them empathy. I think it's one of the most crucial words in healthcare is be empathic with your patients. So do touch their hands, shake their hands. It's the first part of symptomatology. Is the hand cold? Is the skin dry? Is it wet? Does it smell funny? It's also, this is your first diagnostic tool, is your senses. But for that, you have to get a bit closer to the patient. Don't give me all that sterile corona, post-corona period. I want to see and touch my patients. They have to be there. That's why we are doctors. Never forget that. Please do that. It's important. Put your gloves on, I don't care. But do have contact. Helping people in need. Yes, you will always help people in need. Most of them do need your help. A lot of them don't need your help. A lot of them, as I said, could be just boring. They could be hypochondriacs, paranoid, whatever. But you don't know that, they don't know that. Please treat everyone. In Germany, I used to have 3 ophthalmological practices, private practices. Now we're down to 2. We had an open house rule, which means we like appointments. It's great if people make appointments, but everyone that comes in is being seen on that day, no matter how full that surgery is. We will see our patients, because even if he comes in, he just says, I've got an itchy eye or sore eye, my visual acuity has gone down a little bit since yesterday. You never know how important that is. Now, if you refuse that patient because you're telling him, sorry, we're full up, we don't have an appointment, or you don't have an appointment, you will miss out on a diagnosis, and that patient will suffer. Why would you want to do that? It's a 2-minute investigation for us. It takes you like literally no time. It takes you longer to walk to the kitchen, get a coffee, and come back than to see that one patient, and maybe it's that one eye that you saved. Never ever underestimate a patient's needs, no matter how banal they are. Just please take them up and look after them. They are your responsibility. That's your job later on. Next rule. Fat man runs a marathon. Again, referring to a patient who seems fine, but then suddenly crashes. So you get these patients in, they look like they're going to die within the next 10 seconds. They're like, physically, they're down, they're thin, they've got funny skin color, they can hardly talk, and they will still stand for the next 10 years. Now then you get this really fit person coming in, and he just says, I've got a bit of headache. And you go like, okay, come on, you can wait. You're so fit. There's nothing wrong with you. Just sit down. And he's dead in half an hour. He had that stroke that maybe we could have done something about, or that heart attack, or whatever. So please watch out. Again, take every single patient seriously. Everyone. So, the downsides of being a doctor. Let's start. Long and irregular hours. Yes. Totally true. I think it's even more true in your initial phase as residents until you specialize. It will be true in a clinical environment. It will be true even in a private practice environment if you don't know how to organize yourself. So with the 3 private practices, we managed to run them all at maximum level with a 4-day week. Now, it means I had a 4-day week, my colleagues had a 4-day week, the nurses had a 4-day week. We were rotating, and we still managed to see around 3,000 patients per quarter, which is a lot per practice. So you're reaching nearly 10,000 patient contacts with 3 practices in 3 months. And we were not tired. We were not dying. We had, all of us, around 10 weeks of holidays a year. Now, I know it sounds a bit fantastic, and most people will never have that experience. But I was the boss. I could do whatever I want to. It's my home, so I decide. You can practice that in clinic as well. If you are in a big hospital, but you have the problem that you have no say, your directorship will always go, you've got a contract, you do this, you do that. But there are other ways. So if you try and change the system and you find a way, please do. Because the happier you are, the happier your patients are. If you don't feel well, your patient can't feel well. It's not good to treat them. If you have a bad hair day, don't go to work. Call in sick, stay at home, Netflix it out with some ibuprofen and go in the next day. Because there's no point trying to treat someone if you can't really, or if you don't feel up to it. Yeah? Take your time out. Emotional toll of dealing with patients and their families. That's something that I don't think we can teach you. Can we teach them that?
Just methods of how to cope with it, maybe.
Right. Well, for you, it can be tough at the beginning. After a few years, you kind of get a bit more resistant. My advice is if you do have a patient and you have to give them a bad diagnosis, don't waffle about. Tell them straight. This is it. You've got this and this cancer. You've got 6 months. I'm really sorry. That's it. But we're going to try and do the best. Don't go around corners. They will sense it. They will feel it. And they will feel even worse about it. Just be straight up. My rule. I don't know about you.
Say the word dead. Say the word cancer.
Yes. Don't.
Seems harsh.
Yeah. Don't give them, a sad explanation or something like this. Could have been otherwise. No. High levels of responsibility and liability. Yes, you do. Every single day, every single patient is your responsibility, your liability, and it's not necessarily something negative. It actually feels really good because sooner or later you will have kids. Those kids are your responsibility. Well, the patients are the same way. You are responsible for them. Liability, unfortunately, as well. You do have lawyers waiting at the bottom of the clinic. And they will try. It's a new fashion. I think in England it's quite common nowadays, right? In Germany it's not that bad yet, but you will get sued sooner or later. Only who doesn't work does not get sued. So you'll be fine if you don't work. Otherwise, try, apart from your medical friends, try and get a couple of lawyers in as well, maybe. Good ones. It always helps. Saves you so much money as well. Burnout and mental health issues. Yes. Big topic, especially nowadays. If you look at, Twitter feeds, lots of doctors of any kind, nurses, staff, healthcare staff. I'm burned out, mental problems, I'm depressed, I'm on alcohol, I'm on cocaine, whatever else, makes them happy. It shouldn't be. It shouldn't be. If you do organize your life, if you do try and find a way to live with the work you're doing, understand why you're doing the work. You have to know why you're doing the work. If you find a sense in it, then you shouldn't have a burnout and you shouldn't have mental health problems. If you do, then maybe it's something else that causes it and it's not your job. The job should not be responsible for it. You've done your time, we've done our time. I've never had a burnout and I've worked 100 hours a week. I know what it's like in A&E and surgery. I know what it's like. I've never reached a burnout and I've never seen anyone really reach a burnout. So there were other problems with the ones that did crash. So it's not always just work related. The VIP rule, treating wealthy, influential patients with extra care. I love my Trumps, I love my Putins, I love my, whoever VIP want to be, Elton Johns, I never ever prioritize VIPs, not my surgery. We have a two-class system in Germany. You have got your state insurance, which is okay. You've got your private health insurance, which means those patients are paying a lot of money for the same treatment that you get for 25 euros, they're going to pay 300 euros, which is brilliant. I do not prioritize privately insured patients. I don't care. First come, first serve, and it goes by triage. It means symptoms. What is the symptoms? Who comes first? Please don't put emphasis on VIPs. Only if you need them. If you need them for social media, whatever else makes you happy. If you're going into lifestyle medicine, yes, you need your VIPs, no doubt. Otherwise, we are all the same. So if I'm treating Trump or I'm treating the hygienist from here, I don't care. It's the same thing, right? And Trump will probably never pay you anyway. So. The pros of being a doctor. Let's see. Making a positive impact on people's lives is probably one of the best reasons to become a doctor. You really do have influence. You do have your teachers. You're going to be teachers to your patients. That's something you should never neglect. It's getting more difficult because people don't want to listen to you as doctors anymore because you're all overpaid. You know, you're all driving Bentleys and you're all having villas somewhere in South France. Patients hate you for that. Try still and teach them. The problem with healthcare, problem with most diseases nowadays is that there's a lack of education. Back in the days, our parents used to tell us, you can't eat this, you shouldn't eat this in the morning, blah, blah. Nowadays, kids get Coca-Cola for breakfast. They're getting mobile phones and tablets at the age of 4. Take it, sit in a corner and shut up. I need my time out. Nobody educates nobody anymore. Education in general has gone pretty bad. So you are not only a doctor, you're a teacher. Never forget that. Please take your patients. If you have someone who's not compliant, does not adhere to therapy, he's diabetic and his values off the chart, do shout at him. You're allowed to do that. You take him and you sit him down and you're going to give him a good old bollocking. Really, that's what you have to do. And it's your responsibility. If you don't do it, it's your fault that he is going to reach blood sugar levels of 800 plus and he's going to die because you didn't do that. Now, at least you tried, even if you don't. It's not, you did your best. Financial stability and job security. Okay, so who thinks doctors are underpaid? Is that the UK fraction? Come on, 5 minutes. Is that the... Okay, right. Totally underpaid, yes, in so many regards. Especially in the UK lately, what I'm seeing, I think it's disgraceful, it's terrible. You should all try and do something about it. Germany pays so much better, so please all come over to Germany. But even in Germany, a lot of doctors are actually going back to their own country, especially foreign doctors. We have the Romanian doctors, they're going back to Romania, the Polish doctors going back to Poland, and it's not because of Brexit, it's because you get a fair bit of money, but you work so hard and so long for that money, you don't have time to spend that money. So they are thinking, why should I do that? And I'm paying 50% tax and all that. No. I'm going back home, I've got my own infrastructure, I've got my family there, my parents there, I've got a garden, a dog, etc. I can have a lifestyle. So you try and convince these people to come and work in a healthcare system that does not offer them a life. It's just work. It's difficult. So we're going to have to talk about this, which is one of the reasons why you should be in CureMe. Constant learning and growth opportunities. It keeps on going. It's fantastic. As I said before, you will never stop learning. If you stop learning, get out. It means that you're not enjoying it anymore, you're not doing your job, there's no point. If you start reading your BMJ articles, if you start reading your Ärzteblatt articles, if you stop doing that, don't work as a doctor. Just leave it. It gets monotonous, it gets boring. Do something else. Go into crypto, do shares, do whatever else you like. Just respect and admiration from others. Used to be, still is, depending upon the generation of patients you have. I think it depends on the country as well that you're in. I think UK can be a bit tough, especially as you're not allowed to shout back at your patients if they are misbehaving. Are you? It's frowned upon? Okay. Well, in Germany, you can shout at them and tell them off if they misbehave, and you should, because they're coming to see you, and if they're having an attitude problem from the beginning, because your German's not up to scratch, you're young, they don't consider you good enough to be his doctor. Well, sorry, choose someone else. Don't just take it all. Showbiz rule: performing unnecessary procedures for the sake of making a spectacle. You will all do that sooner or later. You will have these patients where you just think, okay, please just get out of my face. I can't take it. And it's the ones that, the night before they've been on Google, they've been researching their symptoms, and they're bombarding you with questions. And they go like, see that redness on my eye or my cheek? And they have nothing. It's just in their brain. So you're doing some funny, cool stuff with their, a little bit of light show and where else, and then you give them a cream and you're going to sort it. You'll be fine in a week. Go. It works. You really have to placebo your patients somehow. Lessons to learn. Quick one. I've got 3 minutes left, right? Don't let the job consume your entire life and identity. Yes, please don't do that. All of my ex-mentors, teachers, professors that I've had, great teachers, really, I do owe them, and I'm totally grateful to them and thankful that they were in my life, and they've been harsh on me partially, not all of them. But they didn't have a life. They were 70 plus, part of them, they had 3 kids. They couldn't tell me the names of the kids partially. They didn't even know what the kids are. It's like all they knew is like for Christmas some kid called up and said like, Dad, I need some cash because I want to go traveling. It's a shame. They lived for their work, but they didn't live their life. So try and find a balance. Now please don't come along with work-life balance. I hate that terminology. I think it's just the biggest excuse for not working in the world. You just have to know what is good for you. Nobody can tell you what's best for you. You know what is good for you, what is best for your patients, and you have to make a cut. So when I did a 4-day week with my private practices, it wasn't because I thought like, oh, let's try that. The Swedes did it first. No, I've just had enough. Working a 5-day week and seeing God knows how many patients, I can concentrate that in a very short period of time and still give the same quality of therapy as before. Why should I spend and waste time in the surgery? Do it at home. Go home. See your parents, friends, see your family, see your kids. Don't forget. Important to prioritize patient care over personal gain. That's up to you. You're going to have to learn that. It'll take you about 10 to 15 years and see where you get. Always question the status quo and seek out better solutions. Always. There is always a better way. If you're not happy with one way, if you're thinking specialization in the UK takes you too long, 10, 12 years, how much is it to become a specialist in the UK?
GP3, isn't it?
GP3, radiologist, you know.
Yeah.
Yeah. There's always other options. You can go to France, you can go to Spain, you can go to Germany. 5 to 6 years in Germany, you're a full specialist, fully fledged, and then you can open a private practice or you can work in a hospital. There are options. If you want to find out, cure me. Have empathy and compassion for all the patients regardless of backgrounds. We talked about this before. Again, the main word is always empathy. Please don't forget that. Be nice to your patients. It could be your neighbor's mother, father, it could be your sister, you never know. Be nice to your patients because they don't know any other. They didn't study what we studied. They never had contact that we had. Balancing work and life, quickly. Crucial to find ways to disconnect and recharge outside of work. Yes, please go out, go and get drunk, whatever you do for leisure. Go and exercise, go and hike, do whatever you need your time out. You need to recalibrate those neurons. It's going to take time, and the magical word is actually decelerate. If you learn how to decelerate, you're there. Setting boundaries, practicing self-care can prevent burnout, improve overall whatever. Maintaining a strong support system of friends and family can provide emotional support and perspective. Absolutely, totally agree. I couldn't have done it without my family in many days and many times and many problems that there were, especially my wife. Utterly grateful to her. Still waiting for those divorce papers to come in sooner or later, but somehow she seems to be clinging on, which I'm, again, grateful for. Right. Future of medicine. Right, this is something that's going to take a while because once I start talking about tech and whatever else, I'm not going to get out of it. Again, I love technology, I love mobile phones, I love whatever is cool, whatever gadgets are on the market, especially medicine, whatever makes your life as a doctor quicker and better to treat patients is great. I like robotics. It's pretty cool actually, especially the Da Vinci system. I don't like things that go into AI, personally, my opinion, yeah, because AI is always controlled by someone in the background, there's always meaning to it. I don't like the idea of robots taking care of us. We're humans, we have human-to-human interaction, okay? So please do think about this. Tech is good, don't overdo it. It's a human-to-human thing. We are the ones treating the patients. It's not the robots treating the patients. The journey continues. Becoming a doctor is just the beginning of a lifelong journey of learning and growth. So please do it. Do it to your own accord. Do it in your own time. Give yourself time for your own things as well. Embracing new challenges, opportunities can lead to personal and professional equilibrium. Totally agree. So you find your equilibrium. Nobody can tell you which one it is. You can spend 100% in the clinic just treating patients, or you can have also a little bit of private time. Now, this is the man that made me study med. I can't believe you've never heard of it. Last rule, the most important rule, really in a medical perspective, because you're going to go to clinic, you have to know that rule, and please read it, live it, do it. At a cardiac arrest, the first procedure is to take your own pulse. Sounds stupid, but it's not. Now, if that patient comes in and you think, oh my God, or you've got a full A&E coming in with like 5 new patients, make sure you're feeling well, because you have to treat 5 patients in one go. take your pulse. If it's not good enough, have that Red Bull, coffee, whatever makes you happy, and then go out. Always make sure you're fine first before the patient, because otherwise you can't do it. And Samuel Sham, House of God. Really, no one's read House of God? Have you read House of God? Who's read it? There you go. Come on, people. You too. Absolutely. Come on.
Is it the same as
Eh?
Is it the same book that you mentioned in the beginning?
Yes. This is, for me, is my Bible in medicine. That's what got me in. It wasn't Emergency Room. It wasn't George Clooney. It was House of God. So who's leaving medicine? Who's doing something else? You? If you are, give me a shout.